It's another interesting episode of Labor Lens where we bring to you update information in the world of work and pay. I am Sharon Ijason. This week's episode will be discussing about the prolonged medical and health workers strike, which has been ongoing for more than 5 weeks. But first, we have a special feature on the prolonged strike. Take a listen. The health workers' strike has been on for more than 5 weeks. It is an unpleasant situation for which many Nigerians have criticized both the government and the workers. Initially, it was the federal government hospital workers under the Joint Health Sector Workers Union (JOHESU) that embarked on an industrial action. Then workers in state hospitals and primary healthcare hospital workers joined the fray. As the strike bites harder, I took time to visit some primary healthcare centers. Many of the PHCs were shut and the beds empty. They had a few patients, or in some cases, no patients at all. And in some cases, unskilled workers were seen attending to patients. This signifies that mothers and children who are the frequent users of these facilities will not have access to proper health care.
I actually came because of my daughter for a particular treatment she needs to take. We wanted to see doctor because she hasn't been well for a while. So I brought her today to see the doctor, but I was just so surprised to my concern that we were not able to see the doctor. All I was told was that the workers are on strike. There is not even a primary assistant or anything to even render to us, to even attend. Nobody even cares to even attend to us.
I came to the hospital so that my child can be immunized, but I was told health workers are on strike. The government should please answer the health workers. They are offering essential services to us, so our children don't fall sick.
The role of primary healthcare centers, state hospitals, and federal university teaching hospitals in the society cannot be downplayed, just the way the role of doctors and health workers can't be overemphasized.
The problem in the health sector is the mismanagement of the health sector. Since 1985, doctors usurped the management and administration of hospitals as chief executives. Hospital and the health sector have never known peace. And you can't offer what you don't have.
Even the masses will have to pay more, and we have to go maybe look for more healthcare services, because it will not be available, it will not be affordable or accessible if that happens. And even those of us who work in the health sector also, the crisis will continue to reverberate.
JOHESU is the umbrella body for medical and health workers, National Association of Nigerian Nurses and Midwives, Senior Staff Association of University Teaching Hospitals, Research Institutes and Associated Institutions, Nigeria Union of Allied Health Professionals, and the Non-Academic Staff Union of Educational and Associated Institutions. Their demands include skipping of cohort promotion arrears, employment of more health workers, enhanced entry point for radiographers and medical laboratory scientists, review of retirement age from 60 to 65 years, upward adjustment of cohort salary scale, amongst others. Topmost on the health workers' demands is the review of their salary. These matters lingered for so long, with the health workers and government meeting at least 6 times without a breakthrough. According to a paper released by the leadership of JOHESU, the table shows the entry point wages earned by a fresher from medical college at GL12 and what a fresh graduate who is a health worker receive at point of entry at GL8 if he is working in a federal government hospital or state teaching hospital. In 2009, a grade level 12 doctor received about 260,000 naira, while the health professional received about 118,000 naira. The difference is 142,000 naira. In 2014, the federal government increased the salary of medical doctors from 260,000 naira to 312,000 naira, while health workers still receive 118,000 naira, placing the difference in figure between the medical doctors and health workers to about 194,000 naira. The joint health workers currently are proposing that the health workers' salaries should increase from 118,000 naira to 165,000 naira, which will place the difference the doctor and the health workers earn to about 147,000 naira. Such wage disparities and poor welfare are the heart of the lingering disagreement between the striking workers and the government. As the effects of the strike bite other, Nigerians eagerly look forward to a resolution which would see the striking workers go back to work.